Hello, my name is Dr. Humayun. I'm one of the consultant endocrinologists at Royal Buckinghamshire Hospital. Today we're going to talk about polycystic ovarian syndrome. A lot of people ask me about this condition, that where there is a problem, is that the ovary is at fault or any other organ at fault, or whether it's an insulin problem. So first thing to clarify that polycystic ovarian syndrome is not a problem with your ovaries. It's actually a problem of insulin resistance. Ovarian problem comes as an outcome of what is going on in the body. And the heart of the PCOS is actually insulin resistance, which typically present with difficulty in losing weight or weight gain and obesity. And that leads to the metabolic consequences, for example, type 2 diabetes, increased triglyceride levels, fatty liver disease, period irregularities, difficulty in ovulation, and then leading to the cyst in the ovaries. So presence of the cyst in the ovaries does not confirm PCOS. Likewise, absence of a cyst in the ovaries doesn't mean a person cannot have PCOS. PCOS is a clinical condition which is diagnosed based on the clinical criteria, hormonal investigations, and that can be supported with the radiological study such as ultrasound scan of the ovaries. PCOS is managed typically depending on what patient is requiring at that time. So if the patient is desiring for fertility, then we focus our attention to improve the chances of fertility. On the other side, if the patient is more concerned about the metabolic aspect, for example, diabetes, cholesterol, blood pressure, or obesity, then the focus of attention should be on these areas. If the patient is struggling with the skin conditions such as excess hair growth on the face, acne, then we focus our attention for the cosmetic aspect and use some medication which try and help improve these symptoms based on what the patient likes. So my suggestion would be, if you have been diagnosed with PCOS, or you wonder whether you might have PCOS, then contact your endocrinologist and get your blood test and clinical assessment done to establish the diagnosis and decide the next course of action.